And I think at some point, what I tell my patients, I'd be interested in your opinion, is whenever you're embarking upon any road, I'm going to go down this road of treatment or that, you should always have a conversation with your clinician about what your timeline for determining success or failure. In other words, if you're going to trial a medication, when will you know if it's been effective or not? Is it a week? Is it a month or two, like you might be on for Prozac, for example, because it needs to be built up to a certain level slowly over many weeks? And if it's not successful, what's the next step? Do you increase the dose? Do you add another medication? Do you try a completely different thing like acupuncture or certain injections? And I think the same thing is true for surgery. And so, like at some point, whether we get to that tonight or not, I always tell my patients, look, at some point post-operatively, usually for me, it's about a year, you will know whether this has been successful or not. And here's how we define success. And so I think if there's one take-home message I could give to people tonight is when you're talking with your clinician, whatever kind of therapy you're doing, have in your mind in a discussion, hopefully with your clinician, about at what point do you determine that's either been successful, partially successful, or totally not successful, and then go in a different direction. And I think if you have that in your mind starting out, it's unlikely you'll have 19 years worth of symptoms before at least you get evaluated for the possibility that a nerve is causing your problems. Now,